Ever wondered why you might be having trouble breathing through one or both nostrils? It might be due to a condition known as a deviated nasal septum. Quite a mouthful, isn't it? But don't worry, it's a common condition that affects many people around the world. So, what exactly is a deviated nasal septum? Well, think of your nose as a house with two rooms, and the septum is the wall dividing these rooms. Normally, this wall is straight and makes both rooms equal in size, but in some cases, this wall can lean to one side, making one room smaller than the other. That's what we mean by a deviated nasal septum. A deviated septum can make it harder for air to pass through one side of your nose, often leading to discomfort and other symptoms. Deviated nasal septum can lead to several discomforting symptoms. So, what signs might suggest you have a deviated nasal septum? Well, symptoms can range from mild to severe, and can vary greatly from person to person. One of the most common telltale signs is difficulty breathing through one or both nostrils. This can be especially noticeable during a cold or allergies when the nasal passages are swollen. Some might also experience frequent nosebleeds. The surface of the nasal septum can become dry and crack, leading to bleeding. Another possible symptom is facial pain or pressure, often on one side of the face or around the eyes. Those with a deviated septum may also have noisy breathing during sleep, which can sometimes lead to snoring or sleep apnea. Lastly, recurrent sinus infections are a symptom that shouldn't be ignored. The uneven nasal passages can prevent the sinuses from draining properly, leading to infection. If these symptoms sound familiar, you may need to consult an ENT specialist for a proper diagnosis. Now that we know the symptoms, what can we do about a deviated nasal septum? The treatment plan for a deviated nasal septum is largely determined by the severity of your symptoms. For mild cases, over-the-counter medications such as decongestants or nasal steroid sprays can be quite effective. They work by reducing the inflammation and congestion, making it easier to breathe. However, for more severe cases, when symptoms persist or significantly affect your quality of life, a surgical procedure known as septoplasty might be recommended. In this procedure, the surgeon works to straighten the nasal septum, improving airflow and making breathing easier. It's important to understand that septoplasty is generally considered when all other non-surgical treatments have not provided adequate relief. Remember, if you suspect you have a deviated septum and it's affecting your quality of life, do not hesitate to seek medical advice. Your doctor can help determine the best course of action for you.